I was diagnosed with advanced prostate cancer at the age of 69 following raised PSA levels and a biopsy. My consultant advised that I should have radiotherapy rather than surgery. I was poised to receive 37 treatments in a local NHS hospital when I simply asked, "And is this the best treatment that is available?" "Oh no," came the reply. "We can offer intensity modulated radiotherapy here, but if you want the best treatment, which is intensity modulated, that's IMRT, plus daily image guided, that's IGRT, then the nearest treatment centre is Cancer Partners UK at Southampton." So I did a little of my own research because I wasn't sure what was meant by IMRT and IGRT. Thanks to my career as a chartered engineer, I was used to studying complex theories, and I found it relatively easy to find out how radiotherapy had progressed rapidly in recent years, especially in the USA. I soon realised that normal radiotherapy can destroy tissue surrounding the prostate, and common side effects could be urinary and bowel incontinence. Also, quite significantly, the prostate gland moves within the body according to the fullness of the bladder and the bowel, and also bowel gas can compromise treatment. So it became clear to me that each of the 37 doses of radiation should focus on the target and not on some nearby tissue. Therefore, the IMRT, the intensity modulated plan, which sculpts the radiation to the shape of the tumour, plus image guidance every day, is very important. So it was not just a matter of adapting the shape of the beam to the shape of the tumour, but if that is the tumour and that is the beam, it is equally important to align them every day so that the treatment is focused on the tumour. I didn't have private medical insurance, but after speaking to Cancer Partners in Southampton, I decided to use my savings to pay for the treatment myself. Having consulted them, I found that my family were very supportive of this idea. At Southampton, the centre has its own car park with no car parking charges, and I soon got to know the names of all the staff. I rarely had to wait for my treatment beyond the time of the appointment. However, one of the medical requirements was to have a full bladder during the treatment, and every journey to and from Southampton took about an hour. So it was not so much driving my old car through the New Forest that was a challenge, but getting the bladder just right on arrival. After a few days, I'd worked it out. The radiographers were very experienced and understanding. They were very happy to vary the time of each appointment by a few minutes either way, so that my bladder was in optimum condition on every occasion. Every day, when I entered the reception area at Cancer Partners, I was greeted by name and made to feel welcome and comfortable. After the patient is carefully positioned on the bed in the treatment room, the radiographers leave and the scanning part of the machine rotates around the patient. There is then a short pause whilst the radiographer looks at the scanned image on a computer. Then the patient hears click, 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 which I found incredibly reassuring because that told me that the bed was being aligned to target my prostate precisely on that day. The radiating part of the machine then rotates around the patient, pausing at a few locations to deliver the radiation. Amazingly, the patient feels nothing, not even any warmth. Soon, The radiographers are back in the machine room to help the patient off the bed. The whole process takes less than 10 minutes. The next port of call is always the loo, and then a friendly goodbye until the next day. I went to see my oncologist in Poole about 2/3 of the way through the treatment, and I cycled to my appointment. He was open-mouthed when he saw me complete with my cycling helmet. Normally, he sees patients who are receiving the standard treatment and they are often sore around the bottom. And he was amazed that I could sit on a bicycle saddle, which was all thanks to the daily image guidance treatment at Southampton. Before and during the treatment, I diligently followed written advice about diet and exercise, avoiding foods that cause bowel gas, and taking a long walk every day. During and after the treatment, I have not experienced any incontinence, whether from the bowel or from the bladder. I have never had any diarrhea. I never felt tired. These were all symptoms that I was told I could experience if I merely had had the standard treatment. With IMRT and IGRT, I have experienced some reduction in flow rate, but now, a few weeks after my treatment, my flow rate is returning to normal. At the end of the 37 treatments, my principal regret was that I would not be coming again. Everyone had been so understanding and reassuring. I'm feeling really good about life now. A few years ago, my wife and I retired to Poole here in Dorset. As a Christian, I am kept busy in the community. In my spare time, I enjoy gardening and a good walk, either near this beautiful Poole harbour or along the Dorset coastline. I can still play football, and I cycle with the grandchildren whenever they come to see us. Looking back, I believe that the absence of any obvious lasting damage to my bladder and bowel totally justifies my choice of IMRT plus IGRT at Cancer Partners UK. During the next few months, I hope that my checkups with an NHS oncologist will show that the prostate cancer has been cured for good.